Hi guys, welcome
Hi.
back to our channel Oral Health Talk. So today we're going to start with STIs, which are sexually transmitted infections. So stick around and come with us on this journey.
Okay, so talking about STI, sexually transmitted infections. Just like the name says, they are infections that are transmitted mostly or only through sex. Okay, and they could be bacteria, they could be viruses, and they could be parasites. So these are basically infections that you get through sex. Now, the CDC, which is the Center for Disease Control and Prevention, carried out a study, and according to the study, each day there is a transmission of 1 million sexually transmitted infections. So every day we live our lives, 1 million sexually transmitted infections are being transmitted to other people. So like this is very important, especially as Africa has a very high rate of sexually transmitted infections.
Next is the types of STIs. We have like a lot. I'm only going to be mentioning a few. We have STIs like gonorrhea, chlamydia, which are like brothers and sisters, or should I say twins, because most times people have both infections at the same time. We have herpes, we have hepatitis, especially type B and type C. We have the human papillomavirus or the genital warts. We have HIV/AIDS, which is very known around the whole world. The organ at the top. We have the trichomoniasis. We have the bacterial vaginosis. We have the pelvic inflammatory disease, and we have the syphilis. So yeah, those are the types. We have like lots others, but this is just the few that we're going to be mentioning in this video.
Okay, so we're going to start with gonorrhea. Yeah, so gonorrhea is a sexually transmitted infection that is caused by a bacteria which is called Neisseria gonorrhea. Yeah,
it's a rated name.
That's where the name comes from. So anyway, this bacteria can be found in the woman's womb. It can be found in her cervix, which is like the neck, the entrance to the womb. It can be found in the urethra. It can be found in the rectum. It can be found in the throat, and it can be found sometimes in the eyes. So these bacteria are basically live in these parts of the body, and if you have any special contacts that involve these parts of the body, you could get gonorrhea. Yeah, and gonorrhea affects men and women. I know I just mentioned that the bacteria can live in the womb and the cervix. It doesn't mean that men are free. Most men have gonorrhea. Actually, it's on the rise now in men than women. So what are the risk factors for getting gonorrhea? Number one is unprotected sex. So sex is apparently a very important aspect of the human life, but it is important for us to also have protected sex, especially if you are having sex with someone who is already infected with gonorrhea. You definitely have to use protection. Now, it's not just vaginal sex. It includes oral sex, it includes anal sex, because remember, we have this bacteria in the rectum and we have it in the throat. So any form of sexual experiment you decide to engage in is a risk factor of transmitting gonorrhea, especially if you are having sex with someone who is already infected. Now, another risk factor is a broken condom. You could be having a protected sex with someone who is infected. If during the sexual excitement, whatever, the condom breaks, your risk of getting gonorrhea from that person increases. Another risk factor for having gonorrhea is sex toys. So many people use sex toys, and especially if you're sharing sex toys with someone who is infected, your risk of getting gonorrhea increases. Now, if you want to use a sex toy that doesn't belong to you, maybe you're borrowing from a friend or whatever, try to put a condom on this sex toy before you use it on yourself to reduce your chances of having gonorrhea. Another risk factor is an infected mother. Now, if a mother is infected and she's pregnant, there's every possibility that this child that she's going to deliver would have gonorrhea infection. And most times when babies have gonorrhea, it affects their eyes, and they have what we call conjunctivitis caused by this gonorrhea bacteria. Another risk factor for having gonorrhea is a low immune system. If your immune system is low for whatever reason, be it that you're a cancer patient or you have HIV, your risk of having other infections, especially sexually transmitted infections, increases. Age is also a risk factor. Based on studies that have been carried out, this infection is much more frequent amongst adolescents and young adults. And then sex, your gender, is also a risk factor. Now, as we heard from the beginning, these bacteria are mostly found in women. Yeah, and so apparently it's more frequent in women, but studies have shown that even though those bacteria can be found more in women, the rate at which men are getting gonorrhea is on the rise. Right now, more men have gonorrhea than women. So men, don't try to play smart. You guys are having gonorrhea. Lastly, the other risk factor will be your lifestyle. Promiscuity. Okay, so if you're the kind of person who sleeps around, okay, we're not judging, but if you're the kind of person who sleeps around, your risk of getting gonorrhea is high, because you're sleeping with different people and you do not know their sexual status. So they might probably have a sexually transmitted infection, and you might get that disease in the process of living this kind of life. It is also important for us to know that the fact that they are called sexually transmitted infection doesn't mean that if the man has to ejaculate for you to get this infection, in this case from the guy. Yeah, as long as you're having sexual intercourse and your private parts are having contact, especially openings like the vagina, so as long as there are those contacts, your risk of getting the disease increases. The man doesn't necessarily have to ejaculate for you to get the disease. So we just want to make that clear so people don't get confused.
Yeah, don't get it twisted. So the next is the symptoms. Now for gonorrhea, sometimes people don't show symptoms, right? That's why people can have this STI for a long time without realizing it. Some of them might even have very mild symptoms where they think they just have a urinary infection, whereas they have gonorrhea. So that's actually something that is very important. The importance of checkup comes in this part. You have to check yourself out well so that you can know if you have gonorrhea or not, in the case where you are asymptomatic. But when it starts to show symptoms, we have the symptoms that the guys feel and we have the symptoms that the ladies feel. So for the ladies, you start to notice that you feel pain in your lower abdomen. You start to notice a change in your vaginal fluid. It's not the normal consistency that it used to be before. It starts to change. You start to feel a change in the nature of your periods, which means in this case you would have more painful periods. If you're the type that doesn't really have pains, you start to feel more pains during your periods. You can have the pain during sexual intercourse, right? You can also have like rectal irritation, as irritation in your anus, the area of your anus, right? Where you can even have bleeding and pus in that place. So that these are some of the symptoms that ladies can present. And for the guys, you would normally start feeling pain during urination. You notice that when you go to pee, you feel pain, a lot of pain, and you might start feeling itchy inside your penis. You can start having something that we call pollakiuria, which is peeing more frequently, like every time you're always going to the bathroom to pee, and it's like in smaller quantities your pee. You can even have like rectal irritation too, just like the ladies, and bleeding and pus. And you can also get discharge from your penis, which could be white, yellowish, or even greenish, right? So these are some of the symptoms that you can present when you have gonorrhea. So please pay attention to these changes so that you can try to get yourself tested so that you can know if you actually have gonorrhea or not, or if you need treatment or not.
Okay, so this is where we're going to end this video on gonorrhea. In our next video, we'll conclude with gonorrhea and move forward with other sexually transmitted infections. Please and please, we're begging you, watch our video, like the video, share the video, and please subscribe to our YouTube channel. Now, if you've not been watching our videos, maybe the topics are not interesting. This one is actually interesting because sex is very important to a lot of people. So you need to watch this video because your sex is at risk. So please watch our videos and share with all your friends and even your enemies, okay? So we'll see you next time. Bye!